Good day everyone. Today I will tackle about wound management and bandaging basic terms. But first, what is a first aid? First aid is the immediate care given to the person or victim who was suddenly become ill or injured. Meaning, ito yung first and immediate assistance na binibigay sa person na nagsasuffer from either minor or serious illness or injury, with care provided to preserve life, prevent the condition from worsening, or to promote recovery. Yung example ng first aid is yung CPR or cardiopulmonary resuscitation habang hinihintay yung ambulance na dumating, as well as the complete treatment of minor conditions such as applying a plaster to a cut. First aid is generally performed by someone with basic medical training. Ito yung mga first aider or related sa medical health. Next is the objectives of first aid. The objective of first aid is the 3 P's. First is preserve life or stop the person from dying. Next is prevent further injury. Stop the person from being injured even more. If possible, an injured person should not be moved or else it will cause more trouble. First aid can include how to safely move injured people or move them anyway with less harm if there is no choice. And the last P is promote recovery. Try to help the person heal their injuries. In promoting recovery, for every wound or injury sustained in the body, there is a prescribed first aid exercise. Depending on the nature and the extent of the sustained injury or wound, first aid attempts to promote recovery. Next, an emergency first aider has various roles and responsibilities. It is important first aiders take these roles and responsibilities seriously, as first aid is potentially life-saving in an emergency situation. The role of a first aider is to bridge the gap between the time of accident and the arrival of the physician. So, bago pa dumating yung physician is naagapan na agad ng first aider yung injury ng tao or nung victim para pagdating ng physician, hindi na masyadong malala or mahihirapan yung doktor. Next is ends when medical assistance begins. So, bago dumating yung doktor, tapos na yung ginawa ng first aider. Next is doesn't intend to compete with or take place of the physician. So, being a good first aider, you must have a good characteristics such as observant. Being observant, you must notice all the signs. Next is resourceful. Make best use of all things. So, dapat maging creative ka. Hindi porket wala tong equipment na to or bandage na to, wala ka nang gagawin. Next is be gentle. Dapat hindi aaray yung pasyente mo pag tinitreat mo siya. Next is being tactful. Shouldn't be alarming. And lastly, sympathetic. Should be comforting. Dapat hindi matakot yung victim sa'yo kasi hindi siya matitreat agad or mahihirapan kang itreat agad yung pasyente pag hindi komportable sa'yo yung pasyente mo. So, the first aid kit must have the following: rubbing alcohol, povidone iodine, hydrogen peroxide, cotton or cotton swab, band-aid, gauge pads, gloves, surgical gloves, bandages like triangular roller bandage, safety pins, forceps, scissors or tweezers, medical tape, splints, and tongue depressor. Pwede ding merong flashlight or cotton balls. So we'll go to the bandage and dressing. The terms dressing and bandage are often used synonymously or magkaparehas, but in fact they're not the same. Bandage is a piece of material used either in covering wounds to keep dressing in place or in applying pressure to control bleeding, to support a medical device, or to provide support to the body. While dressing is used to cover the wounds, prevent contamination, and control bleeding. So, bago mo ilagay yung bandage, meron ka munang ilalagay na dressing. Tapos, pagkatapos ng dressing, tsaka mo ilalagay yung bandage. So, dressing has two types, the adhesive and the gauze dressing. Adhesive dressings are usually mainly for small wounds lang, yung maliit na hiwa or sugat, while yung gauze dressings are thick cotton pads used to cover larger wounds. They are held in place with tape or by wrapping with a gauze strip. So in using a dressing, it must be sterile or it may contaminate the wound. Baka matetano or lumala yung wound ng pasyente pag hindi malinis. So there are three types of bandage: triangular, roller, and tubular bandage. First one is the triangular bandage, also known as the all-purpose bandage. Triangular bandage are made of cotton or disposable paper. They are used for applying pressure to a wound to control bleeding. Next is the roller bandage. These are the long strips of material. Basically, there are two types of roller bandages: an elastic roller bandage and cotton or linen roller bandage. They are used for wound compression if necessary, as they are typically sterile. And lastly is the tubular bandages. Are used on fingers and toes because those areas are difficult to bandage with gauze. They can also be used to keep dressings in place on parts of the body with a lots of movement, such as the elbow or knee. Yung tubular bandage, para siyang sinusuot lang. Unlike the roller and triangular bandage, iniikot pa siya or tinatali. So bandages are necessarily used for covering wounds, applying pressure to control bleeding, and supporting a strain or sprain. Pag hindi kasi na-bandage yung wounds, pwedeng lumala or yung bacteria mismo pumasok doon sa sugat at imbis na maagapan, lalong lumala yung sugat. So, bandaging forms. There are 5 bandaging forms and I did the 3 forms because I have bandage. First is the circular bandaging form. It is used to hold dressing on body parts such as arms, legs, chest, or abdomen for starting others bandaging techniques. Next is the spiral bandaging form, are usually used for cylindrical parts of the body. Next is the figure of 8 bandage form. Involves 2 turns with the strips of bandage crossing each other at the side where the joint flexes or extends. It is usually used to bind the flexing joint or body part below and above the joint. Yung example nito is yung sa may tuhod tsaka sa may elbow. Bale yung side ng gitna ng tuhod is yun yung babandage para makagalaw pa din ng maayos yung victim. Ganun din sa elbow. Next is the recurrent bandaging. It is used for blunt body parts consist partly of recurrent turns. And lastly is the reverse spiral bandage. It's a spiral bandage where the bandage is folded back on itself by 180 degrees after each term. So where should we apply the roller bandage? First, select the appropriate bandage material for the injury. Next, select the appropriate width of bandage. For hand and fingers, 50 mm or 50 mm. Lower arm, elbow, hand and foot, 75 mm. Upper arm, knee, and lower leg, 100 mm. Large leg or trunk, 150 mm. Next is prepare the patient for bandaging and then apply the anchor wrap. Yung iniikot. Para siyang iniikot lang. Parang circular motion. And then apply the bandage wrap to the injury. Next is check the circulation after application of the bandage. Check mo yung pulse distal ng malapit sa injury. Blanch the fingernail or toenail if applicable. Inspect the skin below the bandaging for discoloration. Kung nawawala na ng oxygen or what. Kung nawawala na siya ng oxygen, i-adjust yung bandage para makahinga ng maayos yung blood flow. And next is elevate the injury extremities to reduce swelling or the edema. Lastly is the types of wounds. But first, what is a wound? A wound is a type of injury which happens relatively quickly in which skin is torn, cut, or punctured, or where blunt force trauma causes a contusion. So the two types of wounds are open and closed. Under open, there are incision, laceration, abrasion, or grazes, avulsions, laceration, puncture, and amputation. Abrasion or grazes, ito yung superficial wounds in which yung topmost layer of the skin or the epidermis is scraped off. Yung laceration naman is are jagged, irregular, or blunt breaks or tears in the soft tissue. Avulsion is forcible separation or tearing of tissues from the victim's body. Incision, ito yung cuts in body tissues that are commonly caused by knives, metal edges, broken glass, or other sharp objects. Next is the puncture, are caused by a sharp object that penetrates the skin. Lastly, for open wound is the amputation. Ito yung removal of some part of a limb such as an arm, leg, foot, hand, toe, or finger. So for closed wounds, there are two. The closed fractures and dislocation. Dislocation is a kind of wound from where there is a disturbance from a proper original or usual place. As you can see in the picture, the one with an arrow is the dislocation. Yung part ng buto mo, medyo nawala siya in place. Yun yung dislocation. While yung fracture is a kind of wound or fracture from where the broken bone does not penetrate the skin. May dalawa kasing klaseng fracture, the close and open. Sa close, yun nasa loob yung nabali siya pero sa loob lang. While yung open kasi, lumabas yung part ng buto. There you go, the wound management and the bandaging technique. Next is I will show you a performance in doing a square knot and the triangular footwork that I learned from Sir Rodrigo Lopez.